Good evening. My name is Rita Glennon, and tonight I'd like to explain to you the disease Acquired Immune Deficiency Syndrome. Once again, I would like to share with you, from the world of modern medicine, the latest information regarding AIDS. To explain AIDS briefly, I broke it down into three categories. First, the history of AIDS. Second, the signs and symptoms of AIDS. And third, the care and treatment of AIDS victims. First, let us begin by looking back on how AIDS began, or came into focus, as we know it now. The history of AIDS is rather short-lived, since this disease is not entirely understood. It was first recognized in 1979 when there were about 15 cases of death reported. They received the name Acquired Immune Deficiency Syndrome due to the fact that with all of these 15 cases, the doctors involved had made notes on these, and they could not find any logical reason why the patients got the disease. So it was acquired, not a genetic problem. The immune deficiency was the rest of the term AIDS, immune deficiency syndrome, was brought into focus because the immune system of the body is completely torn down. Nothing works. The cells that would usually come to aid, which are called T cells, are completely taken away and eaten up by the disease. Therefore, when you get a cold or something and your body calls for what they call the helpers to come and take the germ away, these helpers are not even available to come because they have been destroyed by the disease. It's questionable whether or not this disease was also the same as found in people of Zaire, Africa. It is as early as the 1800s they had documents stating that people were dying or had these types of symptoms, but no one knew what it was for and thought that it was only in the Zaire locale since it was found there and nowhere else. It also, there's been some statements made on television programs that the people in Africa ate monkeys and the disease was in the monkeys, and so by eating the monkey meat, it produced the disease in humans. The spread of the disease is also thought to be through the migration of African people to the islands of Haiti, and therefore Haiti is now listed as a place where the gay population go as a resort, and so therefore those people who went to the resort area had relations with the Haitians and brought it back to the United States and Europe. Who gets AIDS? I've made a listing here. There's 95% of people in the United States and also in the world, the cases fall into these four categories. 70% of are in the homosexual and bisexual men with multiple partners. 17% is past and present intravenous drug abusers, which would be you shooting up cocaine or whatever. 4% are the Haitians who enter the United States, and 0.7% are the hemophiliacs. A lot of people have become afraid that if they're a hemophiliac, they will get the disease because some people have gotten it that way. This started because it takes about 10 pints of blood to make a particular dosage. I'm not that familiar with it, but it's a type of medication that they do give to the hemophiliacs. And because it takes so much of the blood, they used it and didn't have any testing for it. And that's how a hemophiliac got it, because it's the medication they were giving them, or the treatment, was from blood. Next, let us examine the signs and symptoms of AIDS and what they are. The symptoms of AIDS are a lot like that of mononucleosis, the kissing disease. I'm sure you've all heard of it. It was rampant in colleges and high schools. Not so much anymore, but it still is on. I myself have had mononucleosis. You usually get a sore throat, fever. Night sweats is not so common with mononucleosis, but it is with AIDS. Swollen glands, which would be the swollen lymph nodes in the neck, the axillary area, which is under your arms, and in the groin area. Weight loss that you can't really detect why is another problem. Diarrhea, fatigue, sore throat, and a persistent cough. It also attacks the nervous system, the central nervous system, by paralyzing, stroke syndromes, and forgetfulness. There is a time when you could be with a victim of AIDS and they could be in the middle of a conversation with you and completely go blank or not know what you've said. The paralyzing could be an arm, a leg. The stroke syndromes, possibly if anyone you know that's had a stroke, their face may droop on a particular side that it's affected. There are two diseases most commonly associated with AIDS also, and that is pneumocystis carinii pneumonia and Kaposi sarcoma. Pneumocystis carinii pneumonia is a lung infection that is caused by a parasite and not like a regular pneumonia. When it gets into the lungs, it's there to stay. It can sometimes be controlled and helped, but it doesn't leave like regular pneumonias would. Kaposi sarcoma is a rare type of cancer or tumor that affects the blood vessels, the walls of the blood vessels, and this is horrendous. They have just total lack of control of anything. It takes over. Also, homosexual patients with Kaposi sarcoma and pneumocystis carinii pneumonia have reported sexual contact with an unusually large amount of different partners. This was taken from an editorial of the 1981 New England Journal of Medicine. It is suggested that promiscuity leads to reinfection of particular viruses taken from AIDS and infectious of homosexual men, edited by Pearl Ma, PhD. In treating the signs and symptoms as best we can, the care and treatment of AIDS victim is both complicated and uncertain. Isolation techniques to keep both the patient and staff protected are as follows. I'll show you. This is the isolation techniques. This is one we definitely follow at Our Lady of Mercy. A private room, a gown, gloves. Masks are questionable, but we use them anyway. And I can show you. This would be your mask. We use a cap over your head. Gloves, if you're going to be touching the patient or having any contact with the patient. These are little booties that you put on your feet, and also a paper gown. Our nurses and technicians wear these when dealing with the AIDS patient at all, and we do have one on our floor at this moment. There have been two diagnosed at Our Lady of Mercy. One is already dead and one is dying. There's also been, according to the CDC, which is the Center for Disease Control, there have been 18 cases listed in Indiana, and there have also been about 113 in Chicago or the Illinois area. According to the Center for Disease Control, oddly enough, it has been reported that physicians are telling their patients to use spermicides and condoms to protective measures if the disease is suspected or just as a general protection, since high concentration of the virus is located in the sperm and the blood. There's also been new research done that it is in tears and can also be in saliva. AIDS victims are also told to eat a well-balanced and nutritionally planned meals, to stay away from people with colds or minor illnesses, since the common cold can be deadly. So stated by Dr. Robert Klein of the Albert Einstein College of Medicine. To conclude, might I stress, show extreme caution in your personal dealings with anyone. This disease is deadly and unfortunately has crossed over to all walks of life and is not limited to those of the homosexual lifestyle. Thank you.